We looked at a variety of ways of keeping total healthcare costs under control. Treating people with chronic illness better, keeping them healthy so that they don't need healthcare services, making better use of digital medicine and telemedicine to be more efficient in the delivery of care. I think towards the end of the decade, the real frontier is going to be to deliver better care to people with mental illness, with depression, anxiety disorder, dementia. That is going to be the real challenge. Let's look at how that might play out. We know that one of the big drivers of healthcare costs are patients who have depression, anxiety, and early stages of dementia. A lot of patients, they get anxious, say, about their cancer, and they want a lot of tests, and that drives up costs. So I think we're going to have a more systematic screening of patients for psychiatric conditions, and then interventions early before they become serious problems. Now, we haven't worked out these problems in detail, and I think the focus on mental health problems is going to come towards the end of the decade, beginning in 2020. Well, what will all of this mean for healthcare and hospital systems? Today, the average bed occupancy rate of most hospitals is 67%. And smaller hospitals, those with 200 beds or less, are operating with 40% or more of their beds empty. But these changes are going to decrease the number of people who go into the hospital. If we actually reduce the readmission rate, that's going to decrease the number of people who go into the hospital. If hospitals become safer with less infections, less falls, less medication errors, that's going to reduce the time patients spend in the hospital. If some of the major illnesses being admitted to the hospital are now treated at home, that's going to reduce the number of people who go into the hospital. The consequence is a lot of this cost saving, this rise of digital medicine, this focus on people with chronic illness and keeping them healthy is actually going to lead to less need for hospitals. And I think 1,000 hospitals are going to close over the next decade. Well, that's not going to necessarily be a problem. They're not actually going to close their doors. They're going to be transformed into outpatient facilities with MRI scanners and surgical suites. Some of them will become physician offices. Some of them will become rehabilitation facilities, and they will have a new life different from being a hospital. And hospitals that do stay open, they'll have a higher bed occupancy rate, and they will operate much more efficiently because they have wringed out a lot of extra costs. So as individuals shop for their own insurance in the exchange, we're going to have unremitting downward price pressure. And as I said, that's going to reverberate in the insurance companies. They're going to have to offer high quality, affordable insurance products in the bronze and silver tier. And they're going to have to be able to do that by negotiating with hospitals and doctors who want to be in the silver and bronze tier to deliver their care more efficiently and at a lower price point. That is going to lead to 4 strategies for saving money: lower per unit prices, so delivering the same high quality care at a lower price; getting rid of unnecessary tests and treatments that don't enhance the health of patients and yet cost a lot of money. Most importantly, it's going to lead to VIP or concierge care for people with chronic illness, diabetes, heart disease, emphysema, cancer, keeping them healthy, away from the emergency room, away from specialty physicians, and out of the hospital. And if they need complex health care, it's going to move that to lower cost sites by using digital medicine to monitor them and more complex care out of the hospital and in cheaper venues like the home. Next, we're going to look at how all these changes and how care is delivered to patients and how it affects insurance companies. Going forward into the next decade, the insurance companies that we know today that collect premium, pay doctors and hospitals, are going to go extinct. They're either going to have to transform or they're going to cease to exist.